I have frequently worked 12 and a half hours without a break. And I can tell you, as I've gotten 16,000 steps in a shift.
Today, we're exploring the culture of care and sacrifice of a special group of nurses.
It's also about when you come in as a patient, we want you to know that you're going to get the best care possible.
Many of those caretakers have come to America to carry on a family legacy.
As my sister-in-law was saying, we could probably build a hospital or a clinic by ourselves.
Today, we're talking about the history and heroics of Filipino nurses.
They really are this unsung backbone to the healthcare system.
This is CBS News Bay Area with Elizabeth Cook.
I'm Makovec in for Liz, and today a story of migration to the Bay Area that's only now being told. How a community of Filipino men and women have survived the pandemic, and a rise in hate crimes to become the unsung heroes of our healthcare system. Nurses have long been the backbone of the American healthcare system, but a shortage of registered nurses has been threatening the system. A 2023 report from the International Council of Nurses calls the shortage a global health emergency. Working conditions are pushing nurses out of the healthcare industry, according to new research at the University of Pennsylvania. Many of them are retiring early. Only 59% say their retirement was planned. Earlier this year, we saw nurses in Santa Clara County going on strike, speaking about insufficient staffing, burnout, and poor work-life balance. Nurses in Hawaii went on strike over similar issues. The conditions are severely affecting the country's Filipino population, which makes up about 4% of the nation's healthcare workforce. Elaine Quijano shows us how this community of caretakers is coping in the wake of the pandemic.
As my sister-in-law was saying, we could probably build a hospital or a clinic by ourselves.
From nurses to therapists to doctors, Nina Batayola jokes there are so many healthcare workers in her family, they could fully staff their own hospital. Nina and her husband, Don Ryan Batayola, left the Philippines in 2007 to work as occupational therapists in the U.S. Then, in early March, they found themselves on the front lines of the pandemic.
And then in late March, he started to get sick.
I finally called the emergency 911 on him. He couldn't even drink water anymore.
Days later, Don Ryan was well enough to FaceTime from the hospital.
We were very hopeful. He looked much better. He didn't like the food. So I said, okay, think what you wanted to eat, call me back, and I'll have it delivered. He never got to call me back. That was it.
On April 4th, Don Ryan Batayola passed away in New Jersey at age 40.
We thank you for welcoming Dawn to thy gates in heaven.
His family paid their respects in an online service.
You were missed while you were gone.
In 1898, the Philippines, which had been a colony of Spain, became a territory of the United States. It became one of the places that the U.S. saw fit to exploit labor from. They basically created a workforce that has turned the Philippines into the largest exporter of nurses in the world.
Many Filipino-American healthcare professionals work at the bedside or in critical care, the kinds of jobs that make you most vulnerable in a pandemic. Filipino-American nurse Jem Scorp works in the ICU at Elmhurst Hospital in Queens, New York, once the epicenter of the epicenter.
Have you been there in some people's final moments?
Exactly. I have a COVID patient. The wife was calling. So, of course, nobody will touch the patient. So I told the wife, I'm not seeing my wife, I'm not seeing my son. So this husband of yours right now is my family.
For months, he stayed at a hotel so he could keep working without infecting his wife and son. Family reunions looked like this.
It must be so difficult. I can't imagine being separated.
It is. It's not easy. Emotionally, it is.
Nursing was Jem Scorp's path to the American dream. For Nina Batayola and her two children, Erica and Enrico, that dream endures.
Even in this painful moment, do you see an American dream for them?
Yes. Yes. I have a dream for them. It might not be the same American dream that I had before.
Stay with us for more on the legacy of Filipino nurses here in the Bay Area. Coming up, what brought so many nurses from the Philippines and how they could be affected by new immigration policies. Welcome back. Today we are talking about the tradition of Filipino families working in healthcare. Earlier, we spoke with the director and producer of the award-winning documentary Nurse Unseen. It details the historical impact Filipino nurses have had on America's healthcare system, especially in the face of the global pandemic 4 years ago. Filmmaker Michelle Hoisway told us she wanted to make this movie to honor her aunties and uncles in her life who've made such a difference in their communities.
I know firsthand that our culture is really rooted in care and community, this concept of kapwa, which is about the collective. So it's really important to be close to your family and to your community and to support one another. So that's basically in our DNA.
The film has already played in several cities, including New York, LA, and San Francisco, and will soon open in several other cities nationwide and around the globe. Hui Sui says she has been blown away by the community reception so far.
A lot of them have been just really moved and touched to see their story on screen for the very, very first time. This film is really emotional. Sometimes people are brought to tears, but there's a lot of joy weaved in throughout the film too. So it is really inspiring. So I hope other communities just get to know a little bit more about what it's like to be Filipino American, especially in this day and age of anti-Asian hate, unfortunately.
She says she got to learn about the history of Filipino nurses immigrating to the U.S. after reading Dr. Catherine Sinisa Choi's book, Empire of Care, which later became the inspiration for making the movie. And Dr. Sinisa Choi is joining us now. Thanks so much for being here.
Thank you. It's a pleasure for me to be here as well.
Well, you're a professor of ethnic studies at UC Berkeley and the author of this book. Where did the idea come from to do this?
The idea came from a very personal place. I'm the daughter of Filipino immigrants, and I was born and raised in New York City, surrounded by a cluster of hospitals. And so many of our family friends and neighbors were Filipino immigrant nurses. And so I got to really know them as friends and neighbors. And then when I became more interested in history and pursuing a PhD in history at UCLA, one of the things I observed is that I didn't see Filipino nurses. I didn't see Filipino immigrants as much in the historical scholarly literature about immigration and nursing. And so it inspired my book.
So why are there so many Filipino nurses in the United States?
That really is the key question of Empire of Care. And so many people think of Filipino nurses as a newer immigrant group. And what I argue in Empire of Care is that there's a longer history to this migration of Filipino nurses. And so many Filipino nurses are here because Americans were there in the Philippines. The US government colonized the Philippines from 1898 to 1946. And one of the things that they did was establish an Americanized hospital training system that trained Filipino nurses in an American style nursing curriculum and also gave them the English language fluency to prepare them to work as nurses here in the United States. And so even though that wasn't initially the intention in the late 19th and early 20th century, that's precisely what happened when there were critical nursing shortages after World War II. American hospitals and other healthcare institutions turned to the Philippines because of their Americanized nursing training and their English language skills.
So the history of the colonization certainly is interesting. Is that what's continuing to keep the stream of nurses from the Philippines to the U.S. going today, or is this just like now cultural?
Well, I think it provides a historical foundation, but I would say it's partly cultural, but it's also a product of more contemporary U.S. immigration policies, such as the passage of the Immigration Act of 1965, which enabled so many Filipino nurses to come and permanently work and settle in the United States, because at that point, the United States, especially in inner cities and in rural areas, they needed nurses. And so these Filipino immigrants, many of them women who are trained in the profession, provided such an important service. And we really have to recognize today, and I feel that Nurse on Scene is such an important documentary because it humanizes these Filipino nurses, these professional workers, and it shows their major contributions to our American healthcare system, which just wouldn't be working as well as it does without the labor and the contributions of Filipino nurses.
Yeah, I mean, you're talking about the contributions to all of our lives in some of our worst moments in the hospitals. It really is remarkable, but it does go under the radar. You mentioned immigration policy having a role in this. Is there any concern that new policies by a second Trump administration could change things?
There's definitely that concern. We're living through a time period not only of changing immigration policies because of the new administration coming in potentially, but also changes in sentiment regarding immigrants in the United States and the rise of anti-immigrant sentiment. And I think what's important about the film Nurse Unseen, and also something I try to emphasize in my book, is that immigrants do so many important things for our country, for our healthcare system. And they really step up on the front lines, literally, sacrificing themselves to help us survive some of these critical times that we've been facing with the pandemic. And so that's something to consider at the present moment.
Absolutely. Oh, we could talk about this for a long time. There's so many aspects. But congratulations on the success of the book and now the movie going forward, Dr. Catherine Sinisa Choi. We appreciate it.
Thank you.
We'll be right back. Thanks for watching. You can always get all the latest headlines and weather over on Pix Plus. And remember to like and click the button on the bottom left of your screen to subscribe for the biggest Bay Area news.